Welcome back to Town Manager's Corner. I'm Scott Lambiase, and I'm your town manager. As many of you know, that Town Manager's Corner, we like to go around and we meet with different department heads or departments. We met recently with Kevin Tachi at AppCam, and we just try to find out what's going on in their different departments, what's going on around town, if there's any exciting projects going on, or relative information that we want to get out to you. And so today, in today's episode, I have Chris Schultz and Lindsay Wright with me. They are familiar faces, but they're our newest department heads in town. And Chris is our new health agent. Lindsay is our, not so new, it's been around a bit, but our public health nurse. So we're going to talk a little bit about, what's going on in their department, and I'd like you to get a chance to get to know them. So we'll start with Chris. Chris, why don't you tell us a little bit about your background and what brought you to become the health agent?
Well, I worked for the VNA of Boston for 20 years, about 4 or 5 years ago, and I like telling this story. Some people know this. Sitting on the couch one night on Facebook, I got into an argument with Alex Haggerty, who was running for the Board of Health.
As we all have.
That's right. We ended up becoming good friends, but I ran a write-in campaign for an open seat. Ended up serving on the Board of Health for 4 years, served as the chair during the pandemic. And then there was a position opened up in the health department, and I had fortuitously gotten laid off from the VNA when they were restructuring. Was looking for something new to do and decided that being involved, working in the health department was a more direct way to have an impact on the community. So I worked as the assistant health coordinator for just a few months, maybe. And then unfortunately we lost Marty. Yeah. And thankfully he had been training me to be an inspector, so I'd already had picked up some of the skills and then just stepped into his role.
Yeah, and you've done a great job, and we're lucky to have you. It's worked out really well. Some of the things I think that, going forward that you might want to talk about, or some of the things that maybe just even your daily activities over there.
So a lot of what I end up doing is fielding complaints or concerns from the community. Mm-hmm. Health department is tasked with inspections of restaurants, tattoo and body art parlors, tanning. We also do Title V inspections. What else? Private wells. There's a lot of different things that fall in.
Swimming pools.
Swimming pools.
Commercial.
And we oversee the day-to-day operations of the solid waste collection in town, which takes up an inordinate amount of time.
Yeah, that is a subject that we'll touch on a bit. But we'll jump over to Lindsay. Lindsay, the public health nurse.
Hi.
Tell us a little bit about your background and what brought you here.
I came from a background in emergency medicine. Did that most of my career. My kids wanted me home more, so a couple years before, a year and a half before COVID, I went to an outpatient OR, just per diem, working hours here and there. Mm-hmm. So I was home more with them. And then when COVID hit, we were all furloughed because they needed the anesthesia teams more inpatient. I was home with the kiddos, and I loved working community-based ERs. I did my time in trauma centers in Boston, loved it, but really liked the community-based emergency medicine that I did, and I loved the teaching part of it. Saw the job posting, figured it would give me a great opportunity to get back and give back to the community, give me an opportunity to go back into a little bit of the education piece that I really liked. So I applied and I got it, and I've been here since.
Yeah, and the position has grown.
It has.
And although I think the objectives of the position have changed and grown, just because of the original needs that we had, we're moving beyond. But why don't we talk a little bit about some of the things that as a public health nurse that you do for the town and the community?
Yeah, so first and foremost is disease reporting, disease tracking and investigation, responsible for a lengthy list of reportable illnesses that I will follow up on and track. as well as investigate and then monitor contacts of, the biggest one being COVID. Everyone.
But beyond that, there's quite a few other things that,
Yep.
COVID obviously has been that monster that just, showed up a couple of years ago and
Yep.
we've been dealing with. But we've always had a need, and by regulation, we have to have a public health nurse who monitors a whole list of other
Yep.
things that come up, and it could be like, I think if somebody got like food poisoning.
Food
or
poisoning,
something like that.
hepatitis C. I monitored the town for tuberculosis. There's a list of at least 150
Yeah.
illnesses that we monitor for. It's all electronic that we keep an eye on. The state reports back to us. And then I also do all of the immunization records for the town. So when we offer vaccination clinics for flu, I reconcile all those orders for the vaccine itself and then the vaccines that we administer. And then I answer a lot of questions for the residents. Anytime, feel free to give us a call. Answer.
You spend a lot of time down at the senior center too.
I do.
Yeah.
Yep, blood pressure clinics. We slowed down a little bit this summer. Just schedules were a bit crazy. We'll pick them back up in the fall on Tuesdays. And yep, we'll do blood pressure screenings, and always available to make arrangements if someone can't come to the senior center. All the community outreach.
Right. And Chris, I think, like we had touched upon, some of the challenges that I think you probably see, going forward, and you and I constantly talk about the waste hauling. It's just a budget buster every year, and it just keeps growing. And I know we have to have some serious conversations on how we're going to deal with that in the future, any ways that we can do to reduce it. But what are some of the other challenges that you're finding?
Well, trash is taking up a big amount of time with that. A lot of it's volume. I think the pandemic moved more people back into their homes, working from home, so we're seeing a lot more volume rather than people spreading it out. It's here.
Yeah.
Textiles and mattresses are being banned from trash come November, so we got to find a new place to put all of that stuff.
And you do that, and I don't know if you have one coming up, the hazardous waste collection day?
Yeah, so that's actually been a nightmare this week. Talk about challenges.
Oh, it is coming up.
Yes, we were originally scheduled for September 10th, and the vendor canceled on us at the last moment. So we've now moved it, I think, to the 14th, which is a Wednesday from 5 to 8 at the DPW.
Okay.
So that'll be any oils, chemicals, anything except latex paint. People can go online and register either through our website or South Shore Recycling Co-op.
And they register and then just show up with as much stuff as they want, or?
Yeah, there's a list of what will be accepted, and they just bring that in and proof.
Is there a fee?
No.
No fee?
There's like 5 or 6 events. The first one's in Abington. There's going to be one in Middleborough, and I think Hanover's hosting one. And there's a couple towards October that are going to be on Saturdays.
Now, where this is part of that co-op, can if someone from Abington was to miss that one, could they go to the one in Middleborough? Or could
Yep,
they go?
they register online, and then just I believe they're given a receipt, and then you bring your proof of residency with you, and it's free as long as it's any of those events.
Awesome, great. And what about you, Lindsay? What do you see, going forward? Some of our big challenges or projects or things that you need to work on.
So going forward, we're looking forward to upcoming flu clinics.
Yay!
Yeah.
Flu season.
Have an exciting event coming up at the library. More details to come, but we're going to be doing some exciting things with the little kids. As far as emergency preparedness, it's called a Prepare with Pedro.
And you just recently did something on emergency preparedness, did you?
I did. I recently just got back from Texas, where I was down there for about a week. Went to Texas A&M and the TEACS program, and spent a week training on expanding incidents and unified command. And I can't say enough about the class and what I brought home from that.
Yeah, because that's something that, I know we've talked on and certainly want to have more conversations with, police and fire on, our emergency preparedness program, which, it's just one of those things that you're never done working on. It's always, in progress or a living document, so to speak, that you just keep expanding on until, and just hope when we need it, we get it right. And, I think with training and in education, that's our best bet to make sure we do get it right. So.
Something have been passionate about my entire career. I've been involved in starting from way back when I before I got out of school, but when I got out of school, I was involved at the hospital side. Always have taken as many trainings, and like I said, the biggest one was recently being down in Texas at TEACS and going through a week-long hands-on multi-exercise program where I developed with a group of 43 other individuals an incident action plan, and we went through the entire cycle of how to do that and how to work as a team and develop a team.
That's amazing.
It was
good work.
Incredible.
Yeah.
Chris has heard a lot about it.
now Lindsay loves EPREP.
Well, that is true. Your office space is pretty close quarters.
So one of our biggest challenges is our office space.
Well, and that is a sort of a challenge in general we're going through at Town Hall right now, as we're busting at the seams and always looking for a place to put records, and every time we go to put them there, we just find boxes of stuff that belong to you guys. So I won't say what's in the boxes. It's top secret, I'm sure. But.
I think the ones that are in that big conference room are Sharps containers. Prepared for all situations.
Now, when is do you have a flu clinic scheduled? Have you?
They will be going live to schedule on color in the next week or so. It's still really early in the season to get a flu shot.
Yeah, it is still summer.
But I will be setting up the clinic dates, but hopefully try to push it a little bit further into September before we start administering. But we have pediatric doses, adult doses, and then 65 plus doses.
And Chris, just to jump on back to the waste hauling is always awful to talk about, but
my favorite subject.
But Boston Carting, I think we found that that switch has been it was a great move. I think that despite the cost that we expected and that are part of the contract. But they've been great as far as customer service, as far as I can tell.
Yeah, I haven't received a lot of complaints. Our two drivers, Mike and Dave, are really dedicated to the town. They know the town. I'm sure residents would give us the feedback they can tell when one of our drivers is on vacation.
Yeah, and the few complaints are probably one, actually, I think that made it my way. They seem to address it pretty quickly and wanted to make sure that they seem to have a desire to please, which is great.
Yeah, they take great pride in what they're doing. I'm talking to them constantly during the day whenever there's problems. So, they're good guys.
Okay. And any other big challenges that you guys see in our near future?
For what looks like to be a interesting flu season is what the predictions are. So please, if you're not same reminder, if you're not feeling well, stay home, wash your hands. But what looks to be a rough winter with flu. But that's kind of every year for us here in New England.
Yeah, it seems like the same old story.
Yep.
Right?
And for all our restaurants in town, we're creeping up on re-permitting.
Oh, it's that annual time. Yeah, that's time. You'd be chasing everybody. And then you'll have to go into a physical inspection of each and every one before the end of the year, is that?
We do them twice a year for all restaurants. So we try to, it's a surprise when I see them, so for them, not for me. But yeah.
But I'm guessing, and I know we can't, divulge anything, but I'm guessing that everybody here, at least everywhere that I've been into, does very well.
Yeah, Abington's a great town to work for. We've got really, really good food establishments in town. They're responsive. When there are problems, they're quick to address them, and for the most part, it's makes my job easy.
Yeah. And I know in the past, and I'm guessing you know it's still the same way. You look at these things more. If there's a problem, it's an opportunity for an education and to help them. It's typically not because of anything other than a misunderstanding or something.
Yep, and food code changes. You know, there are updates to it. So this department is all about education and working with people. We're not. Marty's philosophy was always don't be a jerk, and we both take that very seriously. And it lives on. So.
Well, I want to thank you guys. Is there anything you want to last words or anything you want to add?
Sign up for Code Red?
Yes.
Sign up for Code Red. That's
Code Red.
my favorite thing. That's
Yes.
my favorite new toy.
New toy. Code
Well, actually, I got that giant iPad now, but yours is Code Red.
Code Red is Abington's newest general notification and emergency notification system, and we are using it to send out alerts about traffic situations and avoid areas, weather issues, sewer main breaks. What else?
Generally, I mean, we'll probably use it when we get around town meeting time, notification, or if school's going to be closed.
Yep,
And I know that the school already sends it out, but if you're not signed up through the school.
School uses Constant Contact.
But no, I would imagine not everybody.
Just school age families will receive that.
One.
So Code Red, you can opt in by going on to www.abingtonma.gov and scrolling to the bottom. There's a icon for Code Red. It's really quick and easy. You put all your information in, you can opt in for emergency notifications, general notifications. They go right to your phone, landline, or cell phone, text or email, or all of the above. And that way you stay in the know of everything that happens here in town.
Yeah. So when we do send them out, depending on what your choice is, you may get the phone call, a text, an email. You may get all three, or you could choose just to get one. But generally, that also pops up on our Facebook feed. And would it pop up on the Instagram feed or just the Facebook feed?
For right now, I believe it's just Facebook.
Okay.
We're working on getting it to link over to Instagram.
Okay. And it's on our there's a widget on our website, so it's also on our website.
Yep.
This is our premier, way of getting it is information that we feel like needs to be known right away out to everybody.
This will be the trusted source. The official word from the town will be coming through Code Red. So it's the most official, up-to-date information is coming through that official source.
Now, you're going to be working on some PSAs, so there's going to be some PSAs coming out on helping people navigate how to sign up for it.
Yep, and what it looks like to receive Code Red notifications and how to sign up.
Great. Awesome. Well, I think that's all we have time for today. I want to thank you guys for coming.
Thank you.
I appreciate your time. And I want to thank everybody for tuning in. We'll have another wonderful episode coming up soon with Sean Riley in preparation for our special town meeting. So again, thank you all, and we'll see you soon.